I'm Paul Masson, Chair of Barnsley LPC and Superintendent Pharmacist at Lowes Pharmacy Group. Hi, well, we're here today to present our petition to number 10 Downing Street to raise awareness of the damage that the government's proposed funding cuts will have on the community pharmacy network. The petition is an opportunity for everybody, patients, people who work within pharmacy and the general public, to express their support for community pharmacy and the good that it does for the communities and for the families. The impact of the proposed cuts could be truly catastrophic to the chain of community pharmacies that we have around the country. That network of pharmacies has grown up over years to best serve the local communities that they're placed in, to serve people for their everyday health needs, plus also when they're acutely ill, to take pressure off general practice surgeries and also A&E.
I'm Kevin Barron, Member of Parliament for Rother Valley. I chair the all-party pharmacy group here in Westminster. I have done for a number of years now. The event really is about presenting to Westminster, to number 10 Downing Street, a petition that's the biggest petition that there's ever been on a health matter in the United Kingdom. Well over 1.5 million people have now signed up to this, and it's just to hope that government are listening to what people think about their local pharmacy and how they relate to pharmacy in their lives. As you well know, that government were saying that they're going to run some efficiency savings inside the community pharmacy budget, and I suppose in a sense that the petition is saying what the people outside, the taxpayers, think, the people who pay for the National Health Service think about these cuts. And quite clearly I hope that government's going to be listening to what people who pay their taxes for the health service are saying here today, and the petition that goes to number 10. Taking money out is not going to be helpful, I have to say that. Negotiations are taking place at the moment, but there has been talk, by ministers themselves, about the loss of community pharmacy, and in some communities that is going to be a massive negative thing as far as I'm concerned. I would have liked to have thought that if government wants to change things in pharmacy, they're looking around at how pharmacists can play their role in keeping populations more healthy than we are. Instead of having a national ill health service, actually pharmacists see millions of people every year, and they could be giving them advice on all sorts of things, not just about ill health, but about how to keep healthy and how to look after themselves. And that's a role that I would like to see pharmacists play in the future.
I'm Michael Duggar and I'm the Labour MP for Barnsley East. Well, today is all about the 1.8 million people who've so far signed that petition saying they want to safeguard those vital community pharmacies. It's about making sure that they have their voice heard. It's their National Health Service and these ministers should be listening to them. So it's about making an argument about the importance of community pharmacies in terms of the work they do in supporting public health, but also keeping the pressure off our already overstretched GPs and hospital A&Es. So that's an argument we're going to make loud and clear here in Westminster today. We've got a debate in the House of Commons today, which I'll be leading. A number of members of Parliament will be speaking in that debate. It's fantastic we've got that debate. The Minister will be there. Again, that's just another opportunity for government ministers to hear the views that have been communicated so powerfully by so many people in every corner of the country and communities across the length and breadth of the country. And I really hope they listen to people today. Well, we know, according to ministers themselves, that up to a quarter of all community pharmacies are at risk of closure. That's up to 3,000 community pharmacies at risk of closure. That will have a devastating impact. It's bad news for many of our local communities, but it's also bad news for our NHS, because it will mean that people are more likely to go to see their already overstretched and under pressure GP surgeries, or to turn up at A&E at the local hospital. And so it's not actually going to save any money either. This is a complete false economy. And of course, when I've asked ministers about this, they've said to me, in truth, they can't tell me what the impact of this decision will be. And it seems to me that is a terrible way to make policy. They should be talking to pharmacists, talking to those healthcare professionals, talking to local residents, and get this right, and that means listening to people today.
My name is Laila Habib. I'm the Chief Pharmacist at the National Pharmacy Association. Today, we're all here outside of the Parliament to demonstrate the immense support for community pharmacy. Over 1.5 million or nearly 1.8 million signatures have been gathered on the petition, the biggest healthcare petition out there in the UK. Today, I was at the Elephant Castle at the Elderly Patients Forum talking about the role of community pharmacy and what the government proposals mean if they go through for the future of community pharmacy and mainly for patient care. The support that the public showed us was absolutely incredible, and people were saying all the time that they are behind community pharmacy. They do not want to see even one community pharmacy shut, and they can go beyond anything, any length to demonstrate their support for pharmacy. And in fact, some of them showed up here today, which is absolutely fabulous to see. So, you know, all the signatures on the petition demonstrate how much people do value community pharmacy, and as a pharmacist, it's great to see this. If these proposals and these cuts go through, what it would mean is that we will have community pharmacies, particularly the smaller independents, not being able to function, and that would have an immense issue, create an immense issue for patient care. And a lot of patients are behind it because they don't want to see their local community pharmacy shut. The local community pharmacy is not just about delivering and dispensing medicines, it's also about having regular communication with patients, advising them on various different things, and that would go away if local pharmacies are shut.
I'm Derrick Thomas. I'm the Member of Parliament for St Ives, which is West Cornwall and the Isles of Scilly. We have a significant opportunity today to petition government and Downing Street to look at the opportunity available through community pharmacy for the NHS. Community pharmacy delivers so much already and can do so much more, which is exactly what the government want. And so this isn't the time to be reducing funds, but actually making sure that community pharmacy has the money it needs to deliver health right at grassroots, right on the ground for people that need it most. This petition, 1.8 million people, I think one of the biggest of its kind, is an amazing example of people's commitment to community pharmacy, and they value, people out and about around the country value community pharmacy. We want the government to recognise the real feeling, strength of feeling from the public about it and how they want to make more use of their community pharmacy. But also, the government really needs to understand that there are people that rely heavily, particularly with long-term health problems. They rely heavily on the relationship they have with their community pharmacist. The government is suggesting that the community pharmacy can do more, but at the same time they're suggesting they can do it for less, in fact 6% less. And I don't see that makes any sense. You wouldn't start a business and try and expand the business but reduce the money. We actually need to put the money into community pharmacy now. If we reduce the funding by 6%, it's the independent pharmacists, the people in my constituency that are delivering such an important work in rural areas that I believe will suffer the most. So far 1.8 million people have signed the petition, but we want you to get involved and support the online petition. It's really important that people across the country get involved and sign the petition, which will be easy to find on the internet.
Dora Shergold, and I'm here as a carer and service user. It's about representing the pharmacy that are due to have their funding cut, and to present a petition to Downing Street to let them know that we are concerned about the cuts. I, as a carer and service user, rely on my pharmacy for support all the time, and my concern is that this is going to affect the service they can provide to me, because it will mean job cuts in the industry. I support the petition because this is the wrong thing to do. The government are thinking of reducing the funding to our pharmacies. As a carer, I know how much we depend on those pharmacies. The government have told us we save the country £113 billion a year caring unofficially. We need all the support we can get. I'm part of this because I want to beg the ministers to think about this. Do not take the underpinning away from us. We need their support to keep doing the caring role we do. I think it would be very likely that the delivery service would have to go, that is presently supplied to us out of the pharmacy's own funds, and that is essential to a lot of people, elderly, disabled, and we can't manage without that support.
Hi, I'm Rekha Shah. I am the Chief Executive of Pharmacy London, which is a representative body for community pharmacies right across London. You've all heard about the proposals that the government has for community pharmacies in England, and these were made known to us on the 17th of December. Ever since then, we have been campaigning as a profession, as a sector of pharmacy, against some of the proposals which we feel are not in the best interests of the NHS and in the best interests of patient care, besides the fact that they affect community pharmacies and the network as well. So we had a campaign. Part of the campaign was a petition. This was a manual petition, a written petition, and we've collected 1.8 million signatures on it in the 3 months since it was launched in February. This is fantastic. Apparently the biggest petition of its kind in health in this country. So we are about to go to Downing Street and present it to 10 Downing Street, to David Cameron, and give a clear message to him from the patients, the public, the communities that we serve as Community Pharmacy Network, that they don't want these proposals. They want the government to rethink what their plans are and to do something else about them. So this is really exciting today. I support the petition because, as I said, I represent community pharmacies across London. I also am a community pharmacist myself. I've been practicing for 36 years in London. Community pharmacy is my passion, and I would hate to see it destroyed totally. Yes, there is room for change. There is a need for change as the NHS, as health is modernising. We also need to modernise. However, what the government has planned is totally out of, how shall I put it, out of context. It's not got any proper plans in place, and this petition actually hopefully makes them realise that, and that's why I am totally behind it.
Hi, my name is Mattis, and I'm a trainee pharmacist in South London. We're here today to deliver the petitions that the patients have signed to support their community pharmacy, and we're going to number 10 Downing Street to deliver them. So the impacts of these cuts on patients' lives, which means more pressure on the primary care, and that means more people will go to A&Es for their conditions, which I think it would be a big mistake for the government to cut these pharmacy funds.
I'm Norman Lamb, and I'm the Liberal Democrat health spokesperson, but also formerly Minister for Care and Support. Well, it's to highlight the massive risk to the network of community pharmacies from the government's proposals to reduce the funding of pharmacies, and my real concern is that this will have a big impact on good preventive care, with the consequence that more people end up unnecessarily unwell and in hospital, which is precisely the opposite of what we should be doing.